The following segment is sponsored by the Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I am being joined by Alex Epperly from Dermatology Associates and Skincare Center. How are you doing?
Good. How are you?
I'm doing great. Alex, in continuation of a four-part discussion that we started earlier in the summer, we are talking about some common skincare conditions and problems that you see there at Dermatology Associates during the warmer months. Today we're going to talk about one that, quite frankly, kind of gives me the willies, and that is tick bites. Actually, my mother just experienced that and had a doctor's appointment today. So more importantly, let's talk about how to prevent getting a tick bite. Do you have some advice for us?
Yeah, definitely. So ticks are arachnids. They live in the woods, tall, grassy area. And so a lot of times what a tick will do is it will attach to you as you walk past them. And then the tick will move to like a warm, moist area. It's normally like a body fold or a crease. So that's something that you always want to check after you've been outside in a wooded area to check yourself for ticks.
Okay. So what parts, I hear that, there are different parts of the country where ticks are a little more prevalent than others.
Right.
Do we see a lot of them here in West Virginia? Obviously my mom does, right? But
yeah,
is it pretty prevalent?
Yeah, we definitely do. There's multiple different types of ticks that are more common in different geographic areas. In our area, we have the dog tick and deer tick. It's really common. So when I'm out hiking with my dog, we have to make sure and check.
Right.
There's a few things that you can do as well, though. So if you're wearing like long pants or a long shirt, light colored clothing will really help because the ticks will stand out. You can also use like insect repellents, and then just make sure to check yourself after you finished your activity outside.
And check, you mentioned your dog, and check your pets as well. I would think anytime you've had like maybe gone on a hike with your dog, because I know sometimes they latch onto them, and then they can get sick from it, or it could probably maybe get transfer from the pet onto the pet owner. Does that ever happen?
Yeah, you need to be careful. And, if you were to find a tick attached, we recommend you use tweezers, and you can pull the tick out, and you want to slowly kind of rotate it and remove it. And then after a tick has, bit and attached a host, days, weeks, months after, you can get a little erythematous area that almost looks like a bullseye to that area.
I see that from the picture that we have up. Yeah. Backtrack just a minute here. Can you again go over the best way to remove a tick?
Yeah, so the best way to remove a tick is actually to flip the tick over and then grab the tick with tweezers, and then you can slowly kind of rotate and remove it. You want to make sure to get all of the body parts out.
Right.
And so also if it's been within, 72 hours within that tick bite, it is important you can be evaluated by your dermatology provider because there are antibiotics that we can prescribe to prevent certain diseases that are transmitted through ticks.
Okay.
Really important, yeah.
Okay, very good. And along those lines, I know Dermatology Associates has several locations, and we're announcing today the opening of your newest location, which is in Williamson, West Virginia. Is that correct?
Yeah, Williamson, West Virginia is our newest office that we've just opened. Okay,
great. So just to kind of run down the list, I know we have Beckley, Princeton, Hurricane. Tell me the others again. I know we've got one in Hagerstown, Maryland, right?
Hagerstown, Maryland. I'm in the Charleston office. Yeah, we have Beckley, and Charleston, Hurricane, Williamson, Hagerstown, and Martinsburg.
All right, very good. So I'd say you've got us very well covered. So Alex, thanks so much for sharing this very beneficial information. Looking forward to our conversation next week.
Thank you. Bye.
Take care.